I was born and raised in Alaska. I'm here with a friend, and ended up not in that, so I just kind of went out on my own. I started out in Federal Way and ended up here in Yakima, and then I ended up on the street, homeless. It was the worst time I've ever spent.
So we know that there are some foundational supports that are really important that we pay attention to. Things like somebody's housing status, things like somebody's wage. We know that families living in poverty have worse health outcomes. We know that homeless people living on the street tend to have a lot more health challenges. And so we know that people enrolled in Medicaid face issues that occur outside of their doctor's office visit, and they have real impacts on their lives.
The mission for Yakima Neighborhood Health Service is to provide affordable, accessible healthcare services to all, and also to be able to, end homelessness, or at least participate in the way of ending homelessness that's possible in our community.
We really target what is the medical necessity need that this client is needing to maintain housing or to obtain housing. And we always try to focus on if there's any mental health services that need to be addressed, because we believe that identifying what are those necessities will help an individual stay more stable.
I got anxiety and depression, and had struggled with substance abuse, and it just was a bad deal. I had Hep C, which I did get the cure for that. I did have health services, they through the state. I could go to the doctor, but making it to your appointments and making it to your groups and stuff, it was a whole different story when you're out there with nothing.
So most of the time our folks are just really in survival mode, and when they check into our resource center, they check in with their basic need questions and kind of where it starts. Once we find out what they need and what kind of healthcare service they could benefit from, we kind of go from there. We know that if we give them a purpose, and they have a purpose, that their health outcomes will get better. Their depression is reduced, their anxieties are reduced, and just in general, their health just gets better.
Employment is very important to me. It's hard to find a job when you can't shower every day. It was very hard to make it to work without a stable place to be. Where I used to be, I see it every day. I kind of have a lot of compassion, towards that aren't housed yet. Having housing, it makes a world of difference. It opens up many opportunities that the street doesn't have for you.
And we still really make sure that they're keeping their medical appointments or their dental appointments, or that they're going to the mental health. If they've been diagnosed with substance use disorder, they still qualify for the program. And then we kind of go with them at their own rate about connecting them with individual or with other service providers to help them maintain recovery.
It makes 100% difference having that, somebody checking on you. It's been real helpful for me. I feel like a human being again, part of society. It does. Can't even describe how it is a relief to have that.